Healthy aging was the buzzword during this World Physiotherapy Day 2025. I thought I'll elaborate a little bit on what actually healthy aging is. It means aging gracefully without much disease and disabilities. I have segregated geriatric health into three classifications. The first is metabolic health, the second one is musculoskeletal health, the third one is neurocognitive health. And every aged individual should reasonably enjoy the health in all the three components. Even if one of these three components fail, it can detrimentally affect their quality of life. A good metabolic health indicates that the individual is devoid of hypertension, diabetes, obesity, fatty liver and other cardiovascular diseases or renal diseases which affects their overall metabolism. It's absolutely rare to see anyone after 60 years who is not having any of this disease, but all we ask is, are you managing this condition very well with proper medications, with proper diet and exercises? Meet your consulting doctor and make sure that you are not getting any complications out of this disease. It's not the disease per se is the problem. The complication of these diseases are the real concerning thing. Make sure that your physical parameters, the blood parameters and all other disease specific parameters are normal so that your quality of life is not affected. The second component is good musculoskeletal health. This is my own specialty. Most of these aged people would be having either arthritis or cervical spondylitis or lumbar spondylitis or even canal stenosis. So these are all the common conditions that affects the quality of life of these people. And needless to mention about osteoporosis, which is nothing but weakening of the bone, and sarcopenia, which is nothing but weakening of the muscles. So all these conditions that can lead to aches and pains. These very aches and pains itself can be a major detrimental factors that affects the patient's quality of life. As a therapist, I always warn my patients to get rid of their aches and pains by treating the pathophysiology of this condition pretty early as the condition was first diagnosed so that it won't lead to lifelong disability. To achieve a good musculoskeletal health, you have to have a good physiotherapist who can regularly evaluate you, identify your problem of aches and pains and treat you accordingly so that as long as you are living, you can lead a painless life, which itself is a big blessing. Sometimes you need an orthopedician here because they do help you to give you some medications, sometimes steroids, sometimes surgery as needed, and that's the reason why you need to have an orthopedician in your team. The third component is neurocognitive health. It is not my specialty, but all I can say is Alzheimer's, stroke, neuropathy, they could be the consequence of poor metabolic health. For example, type 4 diabetes is now called as Alzheimer's disease. When you are metabolically unhealthy, your nervous system, like your central nervous system and peripheral nervous system, will be unhealthy. For example, in diabetic neuropathy, it's a problem of peripheral nervous system. It is due to the poor metabolic health, which affects the peripheral nervous system. Thereby, you lose sensation of the sole of the feet and you may risk falling and you may sustain a fracture. This is how it is intricately connected. Your poor metabolic health, for example, if you have obesity, you may end up getting arthritis of the knee joint. Since you could not walk, you tend to put on weight more. That indirectly affects your neurocognitive health. You get depressed, you get demotivated, sometimes you can end up getting stroke. Thereby, your mobility comes to an end. So make sure that you screen yourself for these types of diseases. You have to have a good neurologist for this purpose, or even if you have a risk of diseases or having the disease already, you will be adequately medicated so that you don't get deteriorated with the given disease. So these are all the three phases by which I classify good and healthy aging, but all these things will not happen overnight. Don't think that healthy aging means by the time you reach 60 you put shorts and then wear shoe and walk in the park or go to gym and lift some basic weights. It's not like that. What you sow in the young age, you reap in the old age. If you are genuinely want to age gracefully without any pain or disability or poor metabolic health, start your fitness at your 40 so that you can be healthy and fit at 60. People who are watching this video who are in your 30s and 40s, start acting now. Start eating healthily, eat less, start doing some exercises, some amount of cardio, some amount of strength training, and do regular blood checkup. At least annually once you have to check up, and don't ignore the early warning signs. Most of these arthritis patients, they had simple knee pain 10 years back. That time they keep ignoring until to an extent that it becomes irreversible, then they have to undergo surgery. Most of the disease will give early warning signs. Even diabetes, it gives early warning signs. Don't ignore early symptoms, address it correctly, meet a right doctor, get it clarified so that you don't worsen over a period of time. The biggest and beautiful health is preventive health. it's not about curative health. Once you get into the disease, it's difficult to cure permanently, but once you start doing preventive measures, you can completely avoid getting the disease. So most of these diseases are preventable unless you have a genetic predisposition, and even if you get the condition, at least it is medically manageable provided you address the condition early, treat it medically, treat it by physiotherapy, and make sure that the parameters are all kept in check, and that will allow you to lead a healthy, happy and functional lifestyle. So old people who are watching this video, it is better late than never. You can start your journey today, and thereby you can enjoy the essence of life.